Good evening, everyone. Thank you for attending this month's complimentary webinar hosted by the American Academy of Craniofacial Pain. Today's webinar is Cannabinoids and Craniofacial Pain, presented by Dr. Stephen Todd and moderated by Dr. Cynthia Wiggins. Attendees are encouraged to submit questions using the chat box located to the right of the screen. Questions will be addressed at the end with a question and answer, where Dr. Wiggins will present the questions to Dr. Todd. Make sure to join us next month with Dr. Daniel Clower. He is presenting PRF applications and techniques for TMD, and that will be March 10th at 7 p.m. Central. We are also excited to announce that there are 3 spots left for the February injection course in South Bend, Indiana. You can find out more information at aacfp.org/injectionfeb, or you can email me at info@aacfp.org. All right, your moderator this evening is Dr. Cynthia Wiggins. Cynthia Wiggins, DDS, is a highly experienced family and general dentist at Alpha Omega Dental Center in Marquette, Michigan. She proudly provides a wide range of dental services to help patients improve and maintain quality oral health. At Alpha Omega Dental Center, Dr. Wiggins takes a holistic approach to care, treating the body as a whole. She emphasizes that any oral condition affecting the mouth can have an impact on the entire body, and therefore believes it is always wiser to be proactive rather than reactive. Dr. Wiggins stays up to date with the latest advancements and is an active member of the Fellow Academy of General Dentistry. She is a triple board certified in dental sleep medicine for the sleep apnea treatment by the American Academy of Dental Sleep Medicine, and also board certified in craniofacial pain by the American Board of Craniofacial Pain. She is a diplomat of the American Board of Craniofacial Pain, American Board of Craniofacial Dental Sleep Medicine, American Board of Dental Sleep Medicine, and American Sleep and Breathing Academy. She is also the American Academy of Craniofacial Pain's president-elect. So Dr. Wiggins, if you wouldn't mind taking it away and introducing Dr. Stephen Todd.
Hello, everybody. And it looks like we're all sitting in a little bit chillier weather than what we usually get at this time of the year. And I appreciate everybody taking the time to come and listen to what Dr. Stephen Todd has to present to us tonight. A little bit about Dr. Todd is that he is a dentist who is no longer practicing in his initial trade of oral rehabilitation and dental anesthesiology. He has changed gears, continued his education, and is now working with regenerative medicine as well as dental sleep medicine, both for adults and the pediatric population. He has been providing a personal, relaxed, high-quality care to his patients for over 35 years, and he continues to offer his patients the most innovative treatments and long-lasting results as he possibly can find. He noted quite some time ago that CPAP therapy and oral appliance therapy alone just treated the symptoms of apnea, not necessarily the cause. He has continued his education to both provide additional therapy through Buteyko breathing as well as support of the endocannabinoid system. And please welcome Dr. Stephen Todd in presenting his knowledge to us. Everybody, please add your questions into the chat box, and I will try and make sure that he gets those questions when we have an opportunity to pick his brain.
All right, so we're going to have an overview of the scientific literature regarding cannabinoids and the endocannabinoid system. And I really want to appreciate you guys having me on tonight and being able to present this information. I think this information is super important for clinicians. Dr. Wiggins has really been a first mover in being able to look at this technology and being able to apply it in her clinic. I commend her and I thank her for inviting me tonight to make this presentation. Back to what we're going to talk about. We're going to talk about this scientific literature. And there's a lot to say about this, a lot of information to share. So I entitled this the Hemp Healthcare Initiative because it is certainly hemp is a big deal. And the idea behind this is clinicians and everyone pool together and make life better for others using hemp technology. We're going to talk about the basics of the endocannabinoid system tonight. Unlike computer technology, this is in my comfort zone, so I like talking about this a lot better. So anyway, we're going to be talking about this, and this is basically the components to the endocannabinoid system. These components are on the neurons, and we're talking specifically about neural transmission tonight. And on each neuron of the body, there are what we call the endocannabinoid system is what acclimates our bodies to day cyclics and things that happen in our body. And we have CB1 and CB2 receptors. And these receptors, guys, are on the sending end of the neuron. These receptors were discovered at around 1990 to 1995, fairly recent discovery. The second part of the endocannabinoid system are the endocannabinoids themselves, Anandamide and 2-AG. And these molecules are important in the regulation of the neuronal transmission that goes on throughout the body. The third part of this system are called the enzymes. Now, the enzymes in this area, basically there's a production enzyme such as DAGL and NAPLD, but we're really going to be focused tonight on the fatty acid enzymes FA and MAGL. These enzymes, as you can see here in this diagram, are really interesting in that you can see that the normal enzymes are shaped similar to this. However, what happens is that these enzymes are both in the extracellular cytoplasmic area and also intramembranous area. And these enzymes are very, very interesting because very few enzymes, none other than the ECS enzymes, transfer and transcribe through the membrane, cell membrane itself. And so these enzymes are very, very important in far as regulatory of the endocannabinoid system. But however, these enzymes also change shape, and you can see that a little bit in their overall shape. They will change shape according to the stresses that are put on them, which makes this very, very interesting. When your endocannabinoid system is functioning correctly, and that is head to tail, since neurons are throughout the body, as you know, all neurons are throughout the body, the endocannabinoid system adjusts the tone of the body, how the moods that you have, the movement, the coordination, the life cycles, the reproduction, the circulatory system. Bone metabolism is a big one with the endocannabinoid system. And all this takes place by the endocannabinoid system being regulated and being toned, and that's called ECS tone. It is the way that our body regulates our blood pressure. It is the way that our body regulates our movement coordinations. A lot of Parkinsonian's movements are where you have an irregular endocannabinoid system. So there are a lot of systems that are involved in the endocannabinoid system. It basically regulates the whole body. Now, the research that's gone on recently and within several years, there are three major researches. Raphael Mechoulam is the original godfather of endocannabinoid science, health, and wellness. He is out of Israel. If you'll Google him, he'll come up everywhere. One of his understudies is Dr. Ethan Russo. Dr. Russo is a MD neurologist, pharmacologist. Now he used to live in England. He now is in Washington State, I think it is. And he did a lot of research. He did a lot of research in the United States and overseas on clinical endocannabinoid deficiency. This is a big deal because what this does is this shows the body how the endocannabinoid system, when it's overtoned or undertoned, leads to major health issues. His research in fibromyalgia, irritable bowel, and other treatment-resistant syndromes back around 2004 is groundbreaking research to move endocannabinoids into a mainstream science. And with the passing of the 2018 Hemp Farm Bill in the United States, research in the United States has just sort of taken off. So two people to look for here is Dr. Mechoulam, Dr. Russo, and then also Dr. Mariella Weintraub, who is with Solis, is also a leading United States researcher with Alzheimer's research and with cannabis. Now, the physiology of the ECS is super important. The physiology, basically, there's not a body system that the endocannabinoid system does not affect. CB1 neurons basically are neurons. They are throughout the body, but CB1 receptors are focused predominantly in the brain, connective tissue, internal organs, some in the spinal cord, not so much in the spinal cord, but in the brain and connective tissue and internal glands. CB2 receptors, however, are found also in the brain, but they're also found on the organs and in the peripheral nervous system, in the microglia, for example, and the astrocytes. CB2 receptors are basically a fundamental source of the immune system. They are what allows your immune system to respond. That's what turns your immune system up and turns your immune system down. This research is really ongoing in today's world with CB2 receptors. There are other receptors in the body too, guys, that basically work with the cannabinoid system, and they are endocannabinoid-like receptors. Another receptor is GPR55 that has to do with bone metabolism. Anytime you guys in pain management or as dentists work with a velar bone and things of that nature, CB3 receptors are involved with that. The pain pathways that you guys are so involved with are TRPV1. That is a CB4 receptor. And another pathway is in the serotonin receptors are 5-HT. But a big receptor for you guys is TRPV1 or CB4. Now, the ECS endogenous ligands that we're going to focus on now are anandamide and 2-AG. Now, this is new, in meaning that these two endogenous ligands were discovered about 1992, 1995. I know for a fact that we're on the edge of having additional endocannabinoid ligands to be discovered. I know that they're Mechoulam and Russo in this group. They're right at the edge of finding a couple of other cannabinoids as the science progresses. AEA, as you can see, the molecular structure here is very interesting in that AEA is a fixed molecule, has a nitrogen molecule on it, and it has a couple of oxygens. It is a very, very short-lived neurotransmitter, does not hang around long at all. It was discovered again by Dr. Mechoulam in 1992. It means the bliss molecule. We used to think, and this is very, very recent, as you guys used to exercise and think about having that endorphin opioid pathway to be the area of bliss when you exercise and feel good. That's no longer true. It is anandamide that causes that bliss, that state of bliss when you run and exercise. And anandamide is basically produced by the NAPPLD enzyme and broken down by the Phi enzyme that we'll talk about in detail here in just a minute. It's mostly active at CB1 receptors and less so at CB2. But what's really interesting about this, and we'll talk about this in a minute, is the migration of anandamide to the site of injury once someone has been injured. Research shows how that is a homing injury with anandamide. Very short half-life with anandamide, about less than 5 minutes. The functions of anandamide when the endocannabinoid system is working correctly and we're not under stress, which we are under stress as a society, is that it makes you feel good. It has to do with orgasm. It has to do with ovulation. Oxytocin is driven at childbirth. When babies are born, oxytocin drives anandamide from the mother to the baby, which is really important. When you've heard the term that breastfed babies are healthier than non-breastfed, one of the reasons is the anandamide that gets transferred from the mom to the baby during oxytocin production. Another thing is it's really important for embryonic uterine implantation. As you probably all know, and you guys are experts in the vitamin D deficiencies, that embryonic uterine implantation is driven by vitamin D deficiency. And without anandamide, you get very, very poor vitamin D uptake. But again, that's all about the health of people today. That's really important that people take vitamin D, but also the absorption of vitamin D is less so if they don't have proper anandamide. Another important function of anandamide is during memory transfer. This is in sleep, as you guys know. And when you go to sleep at night, it's important that you get a transfer of your brain only has a certain capacity. It doesn't have unlimited capacity. And so your brain eliminates short-term memories at night and reroutes them and platforms them for the next day and transfers short to long-term, gets rid of short-term, takes some long-term. And what happens is that if you don't have anandamide, you'll get up and you'll say, okay, sort of like I didn't know how to do this computer thing. I'm not sure if that's a short of anandamide. But when you get up in the morning, if you've had a tough night sleeping, the memory transfer, the anandamide hasn't been produced. You've had not as much as you should have had. And what happens is you get memory loss, short-term memory loss. 2-AG is another molecule that's in the endocannabinoid system. 2-AG is found predominantly in the gut. It is found in the brain on CB1 receptors, but also on CB2 receptors. And this is an oversimplification of this system, but 2-AG is a very important molecule for basically gut health in a lot of different ways. You can see it has no nitrogen molecule on it. So it's a different molecule than anandamide completely. They look similar, but they have major, major differences in the body. 2-AG, there's a lot more of 2-AG, supposed to be a lot more 2-AG in the body. However, because of stresses in our society in the last 100 years, since CB2 receptors are focused in the gut, predominantly in the gut, and there are more neurons in the gut than there are in the brain, about 5 times more. There's a massive amount of more 2-AG that's supposed to be in the gut that is not there because of stresses. We've been in short supply because we've had an overabundance of MAGL, the enzyme that breaks down 2-AG. And this is a really important focus for research today. A lot of research is focusing on melanoma, reproductive diseases, and uterine cancer is another one. And these carcinogens are basically driven by an imbalanced endocannabinoid system with overactivity of MAGL. But when it's functioning correctly, when you have homeostasis, when you have that balance, you have basically a healthy immune system with 2-AG. It's really important. It reduces swelling. It is also neurogenic. This is a big deal. Neurogenesis is a part of the endocannabinoid system and a functioning endocannabinoid system. When you have, it supports neuroelectrical brain function. It supports vascular function. These are big deals when it comes to 2-AG function. You cannot overlook 2-AG function as far as being important in the gut flora. Well, with all that being said, guys, about the endocannabinoid system and how important it is, why are phytocannabinoids important today? Why do we talk about phytocannabinoids? These are plant-based compounds now with the cannabis plant that all of a sudden have just sort of said, okay, here we are. Well, first of all, guys, this was banned from the United States till 2018. So when the ban occurred in cannabinoids and then it was removed in 2018 because of the 2018 Farm Bill, cannabis research and cannabis with hemp-derived products are available. Cannabinoids, phytocannabinoids are a big deal in our society today. How does CBD work? CBD works, guys, as an ECS modulator. Think of this. When your body produces this enzyme on the receiving end of neurons, the receiving end of neurons produces the Phy enzyme on every neuron in your body. And that Phy enzyme modulates the amount of anandamide you have. And what happens is that because of stresses, the Phy enzyme gets overproduced. And what we have is we have a decrease of anandamide. CBD basically modulates the amount of Phy enzyme. It ties it up, and it ties it very efficiently. When people take CBD, they say, well, I feel better. And they do, because their neurons, their anxiety has gone down, because their neurotransmission has improved in efficiency. That's why this is important. CBD basically ties up the excessive Phy enzyme that's being produced on the receiving end, on the sending end of the neurons. And when that happens, you have homeostasis that occurs. You have a balancing of the neurotransmission that's going on in the body. The electrical signals that are occurring in the body every second of every day that due to calcium metabolism, things of that nature, the glutamate neurotransmission that affects from one cell to the other, the signaling is regulated by the amount of CBD. And that's why it's so important that people take it. That's why people take CBD and they don't even know why. They're programmed to have a balanced homeostasis environment with anandamide. CBG does the exact same thing. CBG raises 2-AG levels in the body, which have been dormant for so long, by blocking the MAGL enzyme. And that's why one of the reasons that cancer research is focusing so much on the MAGL enzyme, because there are a lot of autoimmune diseases today and a lot of carcinogens that they don't have a handle on in the gut. And so the ability to be able to produce 2-AG by supplementation of CBG is groundbreaking. There has not been a way in the last 100 years to be able to supplement and produce 2-AG in the guts of our population.
In the normal transmission of pain, Ascending nociceptive signals travel up the spinal thalamic pathway to the thalamus, where they are processed and relayed to cortical and other areas. The ascending pathway also relays to the periaqueductal gray matter, an important part of the descending pain modulating system, where specific cannabinoid receptors are located. Stimulation of the periaqueductal gray is known to produce an analgesic effect. However, this neuroregulatory process is thought to be tonically restricted by inhibitory GABAergic off cells. Ascending pain signals relayed through the periaqueductal gray suppress the activity of GABAergic off cells through cannabinoid modulation, thereby increasing activity in the descending pain modulation pathway and increasing the analgesic effect. This is called depolarization-induced suppression of inhibition. A synaptic feedback mechanism is believed to be an inherent part of our normal neuroregulatory processes, including descending pain modulation. In many regions of the CNS, including the periaqueductal gray, the generation of postsynaptic action potentials is modified by an endogenous cannabinoid regulatory system. Endogenous cannabinoids are synthesized on demand from the phospholipid bilayer of the postsynaptic membrane. These lipophilic ligands are released directly into the synaptic cleft and act in retrograde fashion on the presynaptic neuron where the cannabinoid receptors are expressed. Binding of the endogenous cannabinoids affects intracellular signal transduction pathways, reducing the influx of calcium ions into the presynaptic neuron, causing a decrease in further neurotransmitter release. This in turn influences the frequency of postsynaptic firing. The administration of exogenous cannabinoids orally or through inhalation may therefore provide an option for treating pain that has responded poorly to conventional pain therapy. When exogenous cannabinoids are administered orally, they travel via the GI tract to the liver, where they are metabolized before entering the bloodstream and then the CNS. The onset of action from oral administration is less rapid compared to the inhaled route. When exogenous cannabinoids are inhaled, they travel through the respiratory tract to the alveoli of the lung, where they diffuse rapidly into the circulatory system. They then travel through the bloodstream towards the CNS, where they diffuse across the blood-brain barrier and into the surrounding tissues of the brain and spinal cord. Exogenous cannabinoids exert their modulatory effects upon the abundant cannabinoid receptors distributed throughout the CNS. The effects of cannabinoids may be illustrated by comparing three neuronal synapses showing normal pain transmission, the influence of endogenous cannabinoids, and the influence of exogenous cannabinoid administration. Exogenous cannabinoids from the bloodstream bind to cannabinoid receptors on the presynaptic neuron and mimic the endogenous synaptic modulatory effect by decreasing influx of calcium ions. In this way, pain and other neural processes are modulated. The clinical effects of exogenous cannabinoid administration are not limited to pain and have proven effects including the reduction of anxiety, spasticity, anorexia, and nausea. The development of novel drugs to modulate endogenous cannabinoid reuptake and metabolism may also prove beneficial in pain therapy. The therapeutic benefits of cannabinoids, including modification of the endogenous cannabinoid signaling system, should be further explored through clinical research.
All right, so we spoke earlier about the overall endocannabinoid system itself and how it coordinates and works with the other systems of the body. Without the endocannabinoid system, you would not have a coordination, a slowing down, a cooling of the other neurons in the body. That's what it does. It basically controls your blood pressure, controls your thought processes, controls your movements, everything. So without that, you have many, many health issues, as we talked about earlier, that are associated with deficiencies in the endocannabinoid system. But what I want to talk about briefly here is using one of the cannabinoids, which is cannabigerol, which is a cannabinoid. And there are about 100 cannabinoids in the body. One that you know of is THC. That's the most common and studied molecule in the cannabis plant. The second one is cannabidiol. Cannabidiol also has the third molecule that's starting to be studied now. It's called cannabigerol, or CBG. The reason that's important is that is the beginning of the development of the hemp plant. So when the plant comes through the ground and photosynthesis occurs on the plant with heat applied, cannabigeric acid is formed. And as the plant matures further, CBG, or cannabigerol, is formed. And cannabigerol is a fairly new molecule, meaning that even though it's been in the hemp plant for thousands of years, you're not able to capture it in any volume necessary to use the cannabinoid for general use for the public. What Zelise has been able to do is capture cannabigerol in a full spectrum complement of a molecule, so that molecule can then be used with CBD to basically give what we call an entourage effect that allows CBD to help 2-AG production in the gut, to be able to help the things that it's so important that it does. CBG does not convert to THC in the body. There is no THC in cannabigerol, but it is a very, very rare molecule. It's very, very hard to get, very, very difficult to get. If you find CBG at a store or some other place, it's generally an isolate. It's not in a full spectrum plant. Now, CBG is very interesting in how it works too. CBG is a direct CB2 activator, and that's an important part, because CB2 activates, as I've said before, CB2 activation is important for 2-AG function of the gut. There's been nothing to activate CB2 receptors in the gut till now, when you have CBG available as a full spectrum molecule. So CBG is very, very important for immune function and homeostasis. The other point of CBG that is very, very important is the fact that when people lay down at night, they want to sleep at night, and again, as far as the pain, sleeping problems, is that the people generally don't have enough GABA uptake in their body during the day. They're short of GABA. By taking CBG, it enables you guys to be able to potentiate the effect of GABA through the gut, through the serotonin pathways. That's really, really important, because that allows people to maybe slow down and sleep better at night. So just taking CBG alone, even if a person doesn't supplement with melatonin or anything like that, CBG will help your sleep. That's a really big, really important part, because these CB2 receptors are on the immune system as well as on blood vessels. And guys, there's 100,000 miles of microvasculature in the body, and every one of it is activated with a CB2 receptor to be able to make it work correctly. So how important is CBG as a molecule to take on a day-to-day basis? Yeah, it's not been available, and we have tremendous amounts of blood pressure issues in today's society, and a tremendous amount of gut issues in today's society. So you can see how important it is to have and be able to take CBG as a molecule. CBD Benefits is about immune support, preventing inflammatory damage to nerve cells. This is where the research has shown CBG to be used a lot, is in pain relief. And as you guys, as experts in the American Academy of Craniofacial Pain, the reason I showed you that video was because on the pain pathways. And I thought you guys can appreciate that, because y'all deal so much in pain with your patients. But CBG is a benefit for reduction of pain pathways as well as anti-inflammatory. Now, how do they work? CBG and CBD complement each other. And what happens is that when you take, it's really interesting, when you take CBD, you activate CB1 receptors predominantly in the brain. when you supplement with CBG, particularly a full spectrum CBG, you activate CB2 receptors. Well, because of the activation of CB2 receptors in the gut and the peripheral system, CBD can then migrate. It helps CBD home to the site of injury via the CB2 receptors. So the concomitant taking of supplementation of CBD and CBG is really, really important to be able to provide a full homeostasis balancing of the CB1 and the CB2 receptors. CBG does not activate on the same part of the receptor as CBD, and neither does CBD activate on the same receptor site as CBG. So these two very complement each other immensely. Now, the reason you take, just to let you know, one of the reasons you take CBD and CBG, and there's lots of other cannabinoids, is that when you take CBD and CBG and you activate CB1 and CB2 receptors in full spectrum complement formulations, you're getting more of the benefits of the plants. You do not want to take these compounds in isolates or anything like that. You want the full complements of plants at this end. This represents using the whole plant and getting the benefits of the whole plant. You do not want your patients taking isolates or broad spectrum products. And that's very, very important, because when you use full spectrum plants, the whole plant, and you produce full spectrum type of cannabinoids, what happens is you get a greater benefit of both of them. Cannabinoids work best when the molecules are used together. They do not work best when they're isolated from each other. So it's always best when you have patients take full spectrum plants, full spectrum type of products. But what I was trying to do is show you an overview of the endocannabinoid system, what it is and what it is not, how it works within the complements of our body, and then once it works within the body, what molecules are best to use, which is always, so far it shows that CBD and CBG are the two best molecules to use. And then why is that important? In the United States, it's best that all CBD, regardless, is grown on organic USDA certified soil. That's important. The cannabis plant is a bioaggregate. It will collect and clean out soil. The government uses cannabis and hemp in different areas of the United States to clean up toxic waste dumps. And they actually cleaned up the Chernobyl site with it too. So you want to use clean soil. You don't want anything to be in the soil. You want it to be very, very clean with no contaminants. You also want hemp products today to be U.S. Hemp Authority certified. This is a new industry, a new technology. And so without this U.S. Hemp Authority seal, people are at risk of getting too much THC, having problems with it. Some people accumulate a non-full spectrum products will accumulate in the liver, no doubt about that. So you want to make sure it's a full spectrum, and you want to make sure it's water soluble. That's really important in this technology, and a full spectrum. And it also needs to be processed with a CO2 and what's called precision spectrum technology. Cynthia, thank you for having me tonight. I hope you guys got something out of this little presentation, and look forward to talking to you in the future. Thank you.
One of the questions that we have that has come in is, does CBG or CBD or a combination of the both of them or either exist in our typical diets, or is it only available as a supplement?
Yeah, cannabigerol, normal cannabinoids, 2-AG and anandamide, they're the normal neurotransmitters in your body. I mean, you have them, they're there. But what happens is that when you're deficient in 2-AG, for example, and you are deficient in it, everybody is, you don't have a natural supplement. You don't have any way to get that back. That's why
so you can't eat more of a specific vegetable or combination of herbs, etc., in order to get it. The only place to complement what our body makes on our own is through the hemp version of the cannabis plant.
Pretty much that's it. I mean, you don't get any of this supplementation hardly any place else. I mean, that just doesn't exist. That's one of the difficult things about taking hemp derived products. Fortunately, we have this bill to take it now, but it hasn't been available till recently.
And we have one more question that asks, is there a specific product that you recommend to maximize the absorption of the product that can help our endocannabinoid systems run more effectively?
A specific product. In my practice, guys, I use these Zalease products and I have for 2 years. And I find the bioavailability of this is, the best that I've ever seen. Oil products, straight up oil type of hemp products don't have that bioavailability, if that's your question.
So the product that you recommend, you're getting through the Zalease company, and does that come as a combination solution, or does it come as two distinct products that you use them at the same time to maximize their effects?
Yeah, you have two separate products there. You have cannabidiol, which is CBD, and then you have cannabigerol, which is CBG. They're two separate products. They're not put in one bottle or one box. They're actually two separate cannabinoids that are together. And this presentation, guys, focused on just those two, but there are many other cannabinoids that Zalease produces now that are just phenomenal for you in the sleep world and in the pain world. One is CBN, and CBN is, I think, going to be a great product for people to take for sleep and for pain and everything else. So we didn't talk about that, but hopefully that'll get better as time goes on, being able to discuss that better.
So in your practice, Steve, when you have your sleep patients coming in, are you currently backing supplementation of their endocannabinoid system with the oral appliances that you're delivering?
Yeah, what I do, Cynthia, is I include, Ultra System and Dream with every case. I don't separate them out. I have everybody taking CBD, CBG, and then Dream to help with their sleep. And then the way I work it in my practice, and I've just got a practice that just does sleep, is that I sort of look at CBD, CBG as a Rubik's Cube, and I will take off the CBD and bring on CBC if I know a patient has a different issue. So learning how to use these cannabinoids is really, really cool. But I always start patients off with CBD, CBG, and Dream. That's my sort of go-to beginning formulation for every patient.
So to pull out what I think you said in your answer is your Ultra system is the CBD and CBG. And then the Dream is a different supplement that you incorporate for helping them with their sleeping as well. Is that correct?
That's correct. I use a Dream, which is a cannabinoid mimetics product with melatonin and GABA in it. And that's a non-hemp product. And I use that Dream particularly, we didn't talk about that, but I use Dream particularly when a patient maybe for some reason can't take cannabinoids. Some patients can't or shouldn't or won't or whatever that is. But I'll use Dream straight up. It's a mimetics product, meaning that it mimics the cannabinoids pathways, which is really interesting to do that. It mimics the cannabinoid pathways in ways that nothing else can. So the water-soluble formulation of this stuff is what really is the difference in it.
So that mimetics system then is good for people like federal employees that have in their job contracts that they're not allowed to use any type of hemp product or CBD of any type, then they can use that to help them with their sleeping patterns. Is that what you're saying?
Yeah, you can use Dream to help them with their sleeping patterns. And, I would say CBN would be too. There's not hardly any CBD in CBN. So I think it'll help you with your sleep too. But, here's the thing about testing. If people test out and they're looking for cannabinoids of any type, and why they would, I don't know, then obviously if somebody's taking it, it'll show up. But if it doesn't, if they're not looking for THC, they won't show up. So there's no measurable THC in these products. So we've never had anybody test positive, even people that need to take this, that take it even with their job. We never had them test positive for anything.
I appreciate you taking the time to put together this presentation. The video was amazing, and I'd like to get a copy of the link that you had access to it on YouTube. It, I think, was very effective at demonstrating visually the communication process and how the 2-AG and anandamide are involved in the world we're playing with pain.
One thing I want to leave everybody with, guys, is that this science, there's major research going on in the United States today in cannabinoids and in the world. And a lot of it has to do with seizures. A lot of it has to do with bone metabolism, bone cancers. A lot of that's going on right now. And as dentists that are first line care providers, I think it's important that as clinicians that you embrace this technology, embrace it in your practices, and really become what I call clinical cannabinologists in helping your patients go through this minefield, because there's not any good information other than what you saw tonight. There's not very good information out there. And I thank Cynthia for taking the time to have me do this presentation. Appreciate it. Thank you so much. Thank you guys.
Thank you so much, Dr. Todd. You did great. It was an awesome presentation. Thank you, Dr. Wiggins, for being a moderator and a lifesaver with the technology as well. I appreciate all of you, and thank you folks for joining us. Make sure to join us again next month, and we will see you all again soon. Have a great night.
Bye-bye.